wrapping up March. Welcome back to our existing members and a huge welcome to all our VIP members. I know there's hundreds and hundreds of you guys. This is where we interact with each other. I give you a chance to ask your questions. As you might already know, we do private podcasts for you guys. So we announce to you what guests are coming onto the podcast, and you're welcome to submit your questions. We've had really, really good questions this month for our guests. I let my VIP clients know. I let all of you VIPs know what guests are coming onto the podcast, and you can do some research on that guest and then ask them the questions that are on your mind or what you have most, to inquire about. And I will ask it on your behalf in the podcast, and I will exclusively make that available for you guys. We are getting very, very close to the launch of the course. We're still sticking to May 31st for me to launch the course that I built. I told you I was selling this course for $1,795. I am giving it to you guys, to the VIPs. And we've been really intentional, doing a lot of filming, a lot of research. The team has worked really tirelessly on this. So I hope that you guys get a lot of benefit out of it. It will be completely free to you as VIPs. So I want to give a huge new welcome to all of our new members. We're going to have a lot of fun today. I have a very special physician, Dr. Jessica Petros, who's going to join us later. She's going to come on to answer some of the questions that you have. Remember, I am not a physician. I'm not licensed to practice medicine. I do my best to answer your questions, but I have to watch myself. I don't want to tiptoe on the borderline of practicing medicine, but I do want to get all of your questions answered. So very often I will bring licensed board certified physicians onto our VIP group so they can actually take your questions and answer them for you. Then we're actually going to go over to the whiteboard today. I told you last month that this month and going into next, we're going to start focusing and talking a lot about detoxification. And you've heard me answering questions, and probably if you're following the podcast, heard me talk on the podcast about the big four. And these are the underlying, usually not tested for conditions that people live with for sometimes decades, or they have chronic conditions. They have things going on like severe brain fog or joint aches or gut disruption or poor focus and concentration or lack of short-term recall. And you guys are going, that sounds like me. Or frequent headaches, and then your labs look normal, or your doctor tells you everything's fine. So what we're going to do is we're going to talk about how do you search for these things: mold, mycotoxins, heavy metals, parasites, and viruses, and then what can you talk to your doctor about doing about them? What are the best tests for these? I'm actually going to show you my test. My daughter has given me permission to show you hers. So we're actually going to show you what shows up in these tests, what shows up if you do some of these treatments like ozone treatments or EVO2 treatments, what comes out of your blood and ends up in these collection containers. And it's meant to really be a message of hope, because so often people are suffering from these chronic conditions. They have chronic Lyme and don't know, or they have heavy metal toxicity, and no one even told you what the potential side effects of heavy metal toxicity are. And you've got an autoimmune disease, your doctor's treating you for autoimmune. Maybe you don't know how to do some of these underlying tests, or you have a loved one that's suffering from one of these symptoms and they haven't been able to figure it out. So hopefully this is going to be of great value to you and your families. So here's how these calls go, guys. I go through your pre-submitted questions, and after that, I'll open the floor to live questions. I'm going to bring Dr. Petros on. She's going to take your live questions. My goal is to make sure these calls give you clear, practical insights so you can actually apply these things and improve your health and feel great. Sometimes I'll refer you back to your doctor, but I'll give you the questions and maybe even the testing to go talk to your doctor about. So if you have any questions about the app, please drop them in the chat. Our team's here to help make sure you're getting the most out of your VIP experience. And I also want to thank my OG VIPs that have been here from the beginning, because I see you guys in the chat rooms supporting new VIP members. You're always engaged, you're always active. And that was my prayer, was to build a VIP community, an actual community of like-minded people that we've educated, that are inspired to go out and help other people make a transformation. That's why I keep the cost of this low to $97 a month. And that's why I'm going to keep trying to feed you guys more than $97 a month in benefit. So just a quick disclaimer before we get started. Everything I share today is for informational purposes only. It's not medical advice, guys. Please always consult with your doctor or your healthcare provider before you make any changes to your healthcare routine. I will do my best to tell you what I know about current research, supplementation, things like that, but I cannot give medical advice. So let's start going through the pre-submitted questions. I've got them printed here on the paper. These are the most frequently asked questions. I guess I can call out the name of who submitted these, right? Okay, so Clarissa Ravelas, what is your stance on eating eggs for those with thyroid dysfunction, specifically hypothyroidism or Hashimoto's? Also, where do you stand on the controversy around lectins and oxalates in a whole food diet? You know what's so funny? Paul Saladino almost came over tonight and joined us on this Instagram Live. So let's go through oxalates and lectins. Lectins can actually destroy your gut. Very often people are sensitive to lectins. They have almost like spikes on these proteins that latch onto the gut wall. Some people are able to clear these much more easily than others. And it also depends a lot on your gut microbiota. Remember, we have a bacteria called oxalobacteria, which actually processes oxalates. So very often, just the same way that you can be sensitive to something that your spouse is not, or that your children or your friends are not, you can be much more sensitive to oxalates and the damage from oxalates than someone else. The best way to find out is to limit these and get your nutrients from other sources. Very often, I do put people on a carnivore reset diet, not permanently on a carnivore diet, or a keto reset diet, not permanently on a keto diet. But you should be okay to expand your food choices into things like spinach, which is high in oxalates, or kale in limited amounts. But if you find that you get bloating or gas or constipation or cramping, oxalates and lectins are something you want to avoid, along with gluten and highly processed dairy. I think you would find most of the functional medicine community would agree with that. What is my stance on eating eggs for those with thyroid dysfunction? Unless you have an egg allergy, an albumin allergy, or an egg allergy, eggs are excellent for you. They actually are high in selenium. They're high in protein. So they're excellent sources of protein. They actually have healthy cholesterol in them. The yolks are cholesterol. Remember, only 15% of the cholesterol in your blood comes from your diet. So really, our dietary intake of cholesterol is not what's driving the cholesterol in our blood. I think there was a huge revolution against cholesterol in the 90s, and I think it was very misguided, because 85% of all the cholesterol in your bloodstream or that shows up on a test is manufactured by the liver. So if we want to alter our cholesterol profile, we have to change what's going in the front door of the liver. So I would not stop eating eggs unless your doctor tells you to stop eating eggs, or unless you have an egg allergy, even if you had hypothyroid. Rhonda Hafen said, I heard you say no potatoes. Why are potatoes so bad for you? And is organic unbleached flour a better option, or is all flour problematic? So what I said was, when you have high blood sugar, so remember, when you get your sugar tested, you're going to get something called glucose, something called hemoglobin A1C. That's the 3-month average of your blood sugar. And then you're going to get something tested, usually called insulin, which is obviously what brings your blood sugar down. And what I say is, very often when our blood sugar is high, we know what the obvious villains are: cakes, cookies, pies, pastries, brownies, ice creams, sugars, the obvious. We all know that sweets drive our blood sugar. But very often, the bland foods that are high on the glycemic index, high glycemic foods, flour, wheat, pasta, bread, cereals, and white potatoes, we're not thinking of these things as things that raise our blood sugar. So one of the things I said was, if you can exchange your white potatoes for purple potatoes or for sweet potatoes, that's better for your glycemic profile. I personally like sweet potatoes better. Some people don't like the taste of those, but I would prefer that you do sweet potatoes. When it comes to the flour, it's the enriched or fortified flour that I was saying you should try to remove from your diet. The whole reason why you eat pasta here and you blow up like a tick, or you eat bread here and you blow up like a tick, and then you go to Italy and you eat a bowl of pasta, if you've ever done that, or in a basket of bread and some olive oil, and you're fine, you might actually lose weight, is because the folic acid content in the fortified or enriched grains here in the US. Remember, all flour, bread, pasta, cereals, and grains of any kind are required to be sprayed with the chemical folic acid. and the majority of you, not the majority, but about half of you, have the gene mutation that doesn't allow you to process folic acid. Is there any way to get, I've started sprouting everything. Are lectins and oxalates a concern in sprouted legumes like mung beans? No, especially in when you boil or saute or steam these. Steaming is the best way to eat your vegetables, guys. It does break down a lot of these oxalates and allows them to be better digested by your oxalobacteria. It also disrupts a little bit of the insoluble fiber and makes vegetables more digestible. My 16-year-old is, Arthur Hansen says, my 16-year-old is slightly anemic and seems to get sick very often. Her doctor recommended iron and vitamin C. Do you have any additional thoughts or guidance? So I assume that he recommended iron and vitamin C based on a blood test. But if you look at the CBC portion of her blood test, what you should see on there are red blood cells, hemoglobin, and some other markers, mean corpuscular volume, mean corpuscular hemoglobin concentration. You will see on the CBC portion whether or not she is low in red blood cell count or whether or not she is low in the fluid hemoglobin. And there are different types of anemia based on different types, different blood cell profiles. I will tell you the typical treatment for anemia, certain forms of anemia, is folic acid, B12, and iron. The folic acid, let's change that to folinic acid or methylfolate. Talk to your doctor about that. Also asked if the iron version is something called iron bisglycinate. Iron bisglycinate is just known for less disruption of the stomach and less constipation. And the third thing is if she's going to take a B12, and usually it's those three things, if she's going to take a B12, try to make sure it is the methylcobalamin form of B12. Our OBGYN, that was our clinic director for many, many years, whenever she was treating young women that had slightly anemic conditions, I remember she would always start them with iron bisglycinate every other day, methylcobalamin on the daily, the B vitamins, and folinic acid or methylfolate to try to help them make really good, healthy red blood cells. Vitamin C, about 3 times the dose of the recommended daily allowance, was also is commonly given for people with low blood counts. So not being able to see the blood, it's hard to give a specific answer, but it sounds like you're absolutely on the right track. A lot of these women are anemic, especially at 16. She's probably menstruating, and they have what's called hemorrhagic periods, which means that during certain times of the month, they really lose a lot of blood, and this can make them anemic. It's not a pathological condition, but it actually can make them really exhausted, especially when they lose a lot of blood and they're not building it back. Can you discuss who should be taking trimethylglycine and in what dose? Are there benefits to daily niacin use? So I did a podcast with Dr. Gundry, one of the leading cardiologists in the world. And his take on niacin was that taking slow-release niacin along with something called Bergamot O or Bergamot Mega O was something that he had seen positive effects on cholesterol, lipo(a), for which there is no pharmaceutical intervention right now, and also for cholesterol profiles. Trimethylglycine is usually dosed in 1,000 milligrams as an adult. If you look at the back of most trimethylglycine bottles, the capsules might be in 500 milligram capsules. The usual suggested dosage on the back of the capsule is 1,000 milligrams. So trimethylglycine is really good for people with certain gene mutations that do not allow them to break down homocysteine. So remember, homocysteine is an amino acid that's in everybody's blood. Everybody watching this podcast right now or watching this live has homocysteine in your blood. When it rises too high, it can become a problem. Hyperhomocystinemia is linked in certain cardiovascular journals to hypertension. It's also linked to aortic aneurysms. It's also linked to increased risk of cardiovascular disease because hyperhomocystinemia, high levels of homocysteine, meaning homocysteine in the double digits above 10, can irritate the arterial lining. It can cause vascular constriction. It can also cause damage to the arterial wall. So trimethylglycine helps you break down the homocysteine, and turn it into an amino acid called L-methionine. And L-methionine is what goes up and helps to quiet the mind. It becomes something called S-adenosylmethionine, SAMe, one of the most prevalent methylated nutrients in the human body. S-adenosylmethionine then becomes S-adenosyl homocysteine, which is turned into homocysteine. The body has this fascinating way of taking, they say one man's trash is another man's treasure. It will take the byproducts from cellular metabolism from one transaction, let's say the amino acid homocysteine. It will break it down and it will turn it into the treasure for the next transaction. So you'll take homocysteine, turn it into methionine. Methionine will begin to methylate neurotransmitters in your body. Will begin to break these down, and it will turn into something called S-adenosylmethionine. That gets converted into S-adenosyl homocysteine. So this is part of the methylation cycle. So to answer your question specifically, most dosages are recommended at 1,000 milligrams of trimethylglycine. Okay, curious about your thoughts on supplementation with NAD, NMN, and AC-11. I'm not sure what AC-11 is, but nicotinamide adenine dinucleotide, NAD, is the compound, very much linked to aging. It's critical for function inside of the mitochondria. It's a critical part of the Krebs cycle. NAD is actually NAD+, right? So that little positive charge makes very few NAD products capable of going through first-pass metabolism. When I take NAD, I take the liposomal version of NAD by Rho Nutrition, RHO Nutrition. You can either take NAD in the liposomal form, which will protect it from the stomach acid and allow it to go into the bloodstream. There's some really interesting clinical studies on Rho Nutrition's NAD+. Or you can take the precursors, NMN, nicotinamide mononucleotide, nicotinic acid, or nicotinamide riboside. These are the precursors for NAD, and they allow your body to produce it on its own. If a supplement says that it's NAD+, and it's not liposomal, a patch, sublingual, or injectable, it's not telling you the truth. You cannot take NAD+ orally unless it's in a liposomal form. So don't be tricked by those. If you're interested in increasing your NAD, you can try Rho Nutrition's NAD+, or you can do NAD by injection, which is probably not the preferred route, or you can take one of the precursors, nicotinamide riboside or nicotinic acid. So my preference, in order of preference, would be like a Rho Nutrition NAD+. Oh, you actually have it? That's it. Rho Nutrition NAD+. I don't know if you can see that. Yep. Okay. Oh, Damon John's calling me. Hey, Damon. Sorry, buddy. I'm on a live call. All right. The other one is NMN, nicotinamide mononucleotide. That's with a Harvard researcher was made famous for. When taking vitamin D3, is K2 required alongside of it? Yes. Can D3 be taken on its own? And are there risks of having too much vitamin D in blood work? It's very hard to overdose on vitamin D3. You can. The levels run from 30 nanograms per deciliter to 100 nanograms per deciliter. Above 100, you should back off of D3 supplementation. Generally, 5,000 IUs of vitamin D3 with about 80 micrograms of K2 is a great place to start with oral dosing. On your blood work, you should be able to read your NAD levels and see whether or not you need additional supplementation. That should be a part of every blood panel that you do, guys. If your doctor's not pulling your vitamin D3 level, please have them do that. There's some incredible research on deficiencies in vitamin D3 leading to increased risk of breast cancer in women, and actually decreased risk of breast cancer in women with vitamin D3s between 60 and 80 nanograms per deciliter. Oh, yay. Dr. Jess is joining us. We have Dr. Jessica Petras. She's joining us today. I wanted to do something really special for all my VIPs. And what a better way to give back to you guys than to have a board-certified internal medicine hospitalist turned certified Gerson practitioner. If you're not familiar with the Gerson protocol, it's all about food being medicine, and a functional medicine leader to join us. So oh, there she is. I see her hiding on the other side of my screen. Hi there.
Hi, my friend Gary. How are you?
Hi, my friend Jessica. How are you? Guys, if you didn't see the podcast that Jessica and I did, you've got to wait for this to come out. It's coming out very soon. We shot it. I know I did the VIP questions for you guys, so those should be available on the app. Hey, welcome.
Thank you so much. I'm happy to be here.
Awesome. Because your podcast hasn't officially come out yet, but we have done the VIP questions with you. We just tell my audience a little bit about yourself.
Absolutely. Hi, everyone. I'm happy to see everyone here. So, I am formally a board certified internal medicine hospitalist, which means that I was sort of the quarterback of the team in the hospital. The ER would call me to admit anything from diabetic ketoacidosis to sepsis to a bunch of things. I would have to know everything about something. And I worked in that for almost 7 years. And I kind of got a little disenchanted with the system. I started thinking, gosh, I'm discharging people on 30 and 40 medications. How is this health? Why are there Coke and Pepsi contracts for cancer patients in the hospital? Why are we feeding them off the food pyramid, which is, carbs and white flour is the bottom portion of the most food you should have? And I had all these questions. And when I asked people about it and started complaining, they labeled me a disruptive physician. And I
Yep.
ended up quitting. I ended up quitting getting trained in functional medicine, and now I get people off of medication rather than put them on. I get to the root cause. I'm so much more fulfilled in my career, and I feel like the people I see are much happier too. So that,
Yeah, we are so lucky to have you on. I can't wait for your podcast to come out because we go down the road of all things functional medicine. And one of the things we're going to talk about today, mold, mycotoxins, metals, viruses. She is a huge fan of this type of testing and a huge fan of safely detoxing, bolstering our own natural detoxification pathways like glutathione, gut binders, sauna. And so I want to kind of get right into it and get to some of your questions. And then I actually want to go to the whiteboard and show you guys. Actually, let's go to the whiteboard first. I'm just going to spend 2 minutes up here to set the tone. And then can we go to the whiteboard? And then I want to open the floor to questions, and Dr. Jessica and I will be happy to answer any questions that you have. So are we on there? So guys, this is one of my favorite tests. It's actually a vibrant wellness test. And what you're going to see here, don't worry about understanding all of this, but what you see here are some of the most common toxins that we find in these blood tests, in these urine tests. This is an actual urine test. This is a particularly nasty one: aflatoxin A, aflatoxin B. We test for lead, thallium, bisphenols. Those are actually your BPAs, your plastics, the microplastics in your blood. You can actually see these showing up on some of these tests. This particular client had a very high lead, and you see the aflatoxin levels are in the red. What I really want to show you is, even though you see a lot of these toxins in the blood, let's delete this and go back. Even though you see a lot of these toxins showing up in the blood, um, when you actually do some of these cleansing protocols, you can see these come out of you can actually see these come out of the blood into what's called a collection container. You can actually see these showing up in the collection container. This is post EBO2. So you see how the aflatoxin numbers actually went up on this test. The reason why that happened was when we found these in the blood, this client went in to a functional medicine clinic and actually had EBO2 ozone done. And that EBO2 ozone takes the blood out, runs it through a filter, collects the waste from that filter in a collection container. We sent that to a lab, and this is what came out. And that is actually coming from my blood. So this does not mean that these levels were this high in my blood. It means that they register high because they're highly concentrated, having come out of this EBO2 filtration system. After they go through filtration and are collected the fluid is collected, then your blood goes through ozonation, which is O3 gas, and it goes back in. So I really want, next time I'm going to have the team really prepare these. This was poorly prepared today, so I don't know how to cycle through the different screens. But next time I'm going to prepare these so I can actually walk you through what it looks like when the test is done, what it looks like when you examine the collection container, meaning pull this stuff out of the blood, and what it looks like when after you have these things come out of the blood, what happens to your blood serum levels of some of these toxins. I am going to promise you the majority of you have a profile that looks something just like this. Okay. I can't scroll through the. Yeah, but I can't go through. What I wanted to do is show the two reports side by side. I mean, I guess I could go back and forth, but it gets really super confusing. But you could also look at it this way. So these are just different levels of metals. Look at this: arsenic, serotoxin. These are all things that actually came out of the collection container from my blood and showed up in the collection container. Again, these are not the levels in my blood. These are the levels, toxin levels in the collection container, which means they came out of the blood. So next time we'll just do it so we can put them side by side. I want to, so I can be really clear and teach. What I'd like to do is show all of the blood tests next to all that was collected, and then we'll move to the next blood test to show you how those numbers come down. I sent it to JC. It was mine. All right, so let's fire it up, guys. Let's get to some of your questions.
I look at the total
aflatoxin
every day, by the way. Look at that tox every day in every single one of my patients, every single day. The total.
Do you really?
I do.
That's amazing.
Yep. Good test.
Hello.
Is it Trebell?
Yeah.
Hey, Trebell, how are you?
Good. How are you?
Amazing.
So, my main questions are pretty much about my mom. So she's been dealing with mainly three things. One, a little bit of a backstory. About 10 years ago, and this was not in the US, she was crossing the street and she got hit by a small scooter engine. It was really bad, but thankfully she made it out. But ever since, she's been dealing with, I guess you can call it concussion symptoms. They've kind of dialed down over the years, but for the past 4 years, they've kind of been stable. But every time she gets tired, she gets sort of this like dizziness and lightheadedness. And I mean, rest is what helps, but she's been to like doctors she's had brain scans, ears, eyes, teeth, and no one can figure out what the problem is. So I don't know if you might have a recommendation with regards to that.
Yeah, absolutely. I actually had a traumatic brain injury myself, so I'm probably a good person for you to talk to.
Gosh, I would love for her to watch your podcast when it comes out.
Yeah, absolutely. That
keep
comes
an eye
out.
for
I
it.
think it's April 21st, I think is what they told me. So keep an eye out for that.
Not April 1st, not April Fool's Day.
No, April 21st. So yeah, they're really bad because depending on how bad the brain injury is, if she was knocked out, if she had visual changes and nausea, it can really linger and really cause mood disorders, problems with regulating emotions later on if it's not taken care of. And, she had all the scans, she had everything ruled out, but sometimes they don't find everything on MRIs. They don't see everything. So really what I would recommend, what I did was I went to a brain clinic for a week and I let them do all kinds of vision tests, balance tests, and they put me in things like a hyperbaric oxygen chamber. They did things like cold lasers and interactive metronome, which is where you hear the cowbell or a bell and you have to clap on the exact second. And if your brain is fast, like mine was, it's a little bit of a reactive brain, right? And at the end of the week, I was clapping exactly on the beat, and I couldn't do that beforehand. And they test all kinds of balance and things for you because the vision, the way the teeth hit, the way the feet hit the ground, all talk to the brain about proprioception and balance. So it's really important that all those are taken care of. Now, I'm not her doctor, but some of the supplements that are really, really helpful for traumatic brain injuries, high dose EPA or DHEA, also known as omega-3 fatty acids. Really important. I like the ones that actually have mackerel or salmon roe in the capsules. Body Bio has a great supplement. Magnesium is really important. Curcumin or turmeric is really important, really anti-inflammatory, and brings down neuro or brain inflammation. Vitamin D is important. I know you guys talked about that a bit. B vitamins, especially methylated, if you can handle methylated B vitamins, are really important. And then things like glutathione, vitamin C, antioxidants, and amino acids are really important. And sometimes when people have brain injuries, they're kind of set up as a sitting duck for other infections because that injury is already there, things like Lyme disease and things. So you always want to keep a lookout on things for that too. But that's what I would suggest is going to maybe like a chiropractor or a functional medicine doctor who can run some functional tests and specialize in the brain and do
Is your
some.
mother in the U.S.?
Yeah.
She is. Okay.
Perfect. I mean, where do you guys live, if you don't mind me asking?
Minnesota.
In Minnesota. I don't know anyone in Minneapolis or Minnesota right offhand, but I have a lot of connections and I put feelers out. But if I were you, I would Google like brain clinic or, traumatic brain injury brain clinic in your area and see what you can find. Because stacking some of those therapies will make a big difference for your mom.
And I would be happy to, at no cost, to put you in touch with Dr. Jason Saunders, who actually wrote the book Hyperbaric Medicine, has a PhD in hyperbaric medicine, and is very equipped to deal with TBIs, CTEs, concussive injuries, traumatic brain injuries, neurodegenerative conditions in the brain, with hyperbarics. And very often you can get a script to have a hyperbaric in your home. A doctor can write you a script for that. It's something that your mom can do at home. And I've seen cases of his where he's had dramatic results.
Yeah, that'd be great. Thank you.
Awesome.
Would I be able to talk about one more thing?
It's usually only one question because I've got
Okay.
hundreds of people on here, so I really want to try to be respectful. But submit it to the team, and if it's something that I can direct to, one of the physicians, or it's something we can ask, answer on our own, we'd be happy to do that. Awesome. Hey, man. Kevin, you're muted, brother.
There we go. Am I on?
There we go.
Hey, real quick, just a real quick confirmation of what you were saying. My wife and I did the environmental toxin panel, the heavy metal, and the home mold test. And surprise, surprise, we have mold in the house. Yep.
Yeah.
But
yeah.
So that's the stage we're in right now. But my question is, I've been diagnosed with pernicious anemia, which I have very high B12 levels, and my doctor's like, well, something's up with that. So he did an intrinsic factor test, and I guess I'm not real clear on what that means, but he said at this point, you're probably going to have B12 shots, but we'll try B12 sublingual 2 times a day. And we're doing hydroxycobalamin. So is there anything else that you can think of, or?
I love that you're doing that. Now, most people who do have a deficiency of intrinsic factor, it's usually caused by conditions that damage the stomach lining, or they affect these cells in the stomach called parietal cells, which line the stomach, right? And without intrinsic factor, like you said, you can't absorb B12 from the small intestines. And without that, it really causes like hormonal issues, problems with neurologic issues and depression and things like that. It's really important to treat pernicious anemia correctly. Okay. So, really getting IVs is the best thing to do here. The other thing you may want to look at doing is look at things that are liposomal that you can absorb under the tongue in the buccal cavity. You don't have to worry about going down to the first pass of the stomach to reabsorb that. So sometimes that's kind of a workaround around IVs, is being able to find things that are liposomal and nano that absorb under the tongue.
Okay.
Right? Okay. Do they know why?
Yeah, and
oh, go ahead.
Yeah, sorry. It's very common for people that have B12 absorption deficiencies to have very high levels of B12 in the blood, and they think it's the opposite of what they should be thinking, which is, if my cells are not capable of uptaking B12, then the serum of my blood might have high levels of B12. So very often you can start thinking I should stop all forms of B12. I should try to get B12 out of my diet, when really it's an absorption issue, not a deficiency.
And you can know for sure by checking a urine methylmalonic acid or urine MMA. This lets us know, hey, it's the B12 passing through the cells and being absorbed and processed by the body and then able to be peed out. So that's a little more accurate than a serum B12. But just some tidbits for you, Kevin, about things. People who get problems with intrinsic factor or, any sort of problems with an autoimmune thing like pernicious anemia, most of the time is. One thing you really want to look at is, do you have any pathogens there in the stomach, like H. pylori causing a problem? And do you have low stomach acid? Low stomach acid in general will not let you absorb B12. So these are some of the other like acquired reasons you could have something with like pernicious anemia.
Okay. All right. Thank you.
You're very welcome.
Awesome, Kevin. I hope you guys are finding these helpful. Usually when somebody has a question like that, lots of people have the same question. So
yes.
Hey, Gary, thanks for what you do. This
you're
question is, hi. So this is from my wife, right? For the last 15 years, she has not been well, right? Tired, exhausted, fatigued. And then 15 years back, she was diagnosed with Hashimoto's. And then she started taking the medicine. Nothing happened. Her condition started slowly getting progressively worse. So for 7 years, she was taking the medicine, and then she just stopped, saying that it's not making a difference. And since then, we have been on this circle of going to different doctors and waiting for results and going and checking. So some of our key symptoms are like she has high inflammation. A CRP is greater than 10, right? Low iron, vitamin D, but she's now supplementing it. And she also has like PMS, I think that started. And her right leg is inflamed, right? And she's unable to lose weight. So I think she has a lot of these issues. Over the last few months, we just started taking the 10x. We took the 10x test, and
Beautiful.
turns out she has both the gene mutation, right? So she has been taking the TMG and then the COMT. So that actually made a difference. Literally, she said it's almost like a light bulb went on in her brain.
Oh, that's so good.
Yeah.
Isn't it amazing what you can just do with nutrients in the human body? I'm so happy to hear that.
So we just started this journey with 10x, and I know now you have this one, and we are excited to be here. And all we want to do is get well. All she wants to do is get well, get back to being an ultimate human. So
yes,
we are happy to kind of participate. I know in one of the calls you mentioned that if you want someone, right, and work with someone and kind of televise it or like record it, I think she'd be an ideal candidate because 15 years she's struggling, and out of every 30 days, in a month, 15 days, she's unable to do anything because of fatigue and tiredness.
Why don't you do that? Why don't you submit it to info@theultimatehuman.com, especially since she's had this condition for 15 years. And nothing would make me happier than to see the clinical team turn this around for someone over the next few weeks that's been struggling like she has for 15 years. I would love to do that for you. So info@theultimatehuman.com. But while we have Dr. Jessica on, I'd love to hear her insights. I'd be happy to give you mine.
Absolutely. Can I ask a few questions, Sampath?
Sure.
Okay. Does she have any root canals?
I think a teeth was replaced around 15, 20 years back. I think one teeth.
There is one that was put 15, 20 years ago. How long ago did she start having symptoms?
I think all the time. I think since like 2006, 2007, almost like 20 years ago.
About the same time.
Yeah. And one other thing I also didn't mention is like the hair loss. So that's like constant too. She had a lot of hair, and then now it's like literally it's like.
So there's inflammation in the body, and unchecked inflammation is the root cause of all disease, but it's not the root cause. Something is causing the inflammation, is causing her body to see a problem. So some of the things I see that are roadblocks to healing: water damage in the house, mold, endotoxic bacteria that can grow in water damage. Sometimes people have a sensitive genotype for mold, HLA-DR, have the same genotype that causes thyroid disease. Okay, so water damage in the home will suppress the immune system enough to cause an autoimmune condition every single time. Root canals are a man-made procedure, the only place we leave dead necrotic tissue and think it's okay. After about 10 to 15 years, usually most of these root canals fail. They don't cause symptoms at the local site. They cause them systemically. chronically in the body: brain fog, rashes, eczema, autoimmunity, cancer. So what I
Diffuse alopecia is another big one. Yep.
absolutely, hair loss, all
Hair
that stuff
loss.
you're saying. Yes. And so really be careful here in that. I would love for you to find a holistic or biological dentist and get a 3D cone beam scan. Now, a
I'm
cone
going to refer you to Dr. Gandhi. Can you just make a
perfect.
note?
Perfect.
For Dr.
Because
Gandhi.
what happens is what they'll see is a pocket of simmering infection underneath the root canal, sometimes eating away at the bone even. When they pull that out, it's black with cysts on it. It smells like death, and people start to get better. Okay. So breast implants are another one. Root canals, water damage in the home, being in flight, fight, or freeze. That one too is huge. Until we fix that, I can't fix autoimmunity. So these are some of the clues that I'd give you about this, because, and then also look for things like parasites, mold, you know, Lyme disease. These type of things cause chronic fatigue, migrating joint pains, and brain fog.
Are we connected to that?
Okay.
I want to show. Can you show the connection between?
Do you have any other questions for me?
Yeah, like she has like every time she sleeps, her neck and back are very sensitive, and like her sleep is also now getting more disturbed because of that.
Well, she's not, her body's hyper vigilant. She's in sympathetic overdrive. So to get into rest and digest where she feels safe to be out all night is going to be impossible until we can fix her autonomic nervous system, in my opinion.
I really suggest you watch the podcast I did with Dr. Jigar Gandhi. He's one of the best, in my opinion, biologic dentists in the country. There are lots of really good biologic dentists, but he does have the cone beam X-ray. He actually has done 3 teeth in my mouth. He's done 2 in my wife's mouth. He's done 2 in my daughter's mouth, 2 in my youngest daughter's mouth. So 4 members of my family have been to him. And I'm actually in the process of documenting a story of a client. It was a client of mine, but was treated by Dr. Gandhi, and the incredible amount of just life-changing results he had with having these root canals cleaned out. She's right. Dentists are the only practice of medicine that believe that you can leave dead tissue in the body. And if you've had a root canal, the root is killed, meaning the nerve is dead. So you don't feel it. I didn't feel it. The blood supply is cut off. So now you have a necrotic area in the body that is just seeping into the bloodstream or through the nervous system and causing all kinds of conditions. Can we throw this up here? I think I showed this to you guys on.
Oh, yes.
I think I showed this to you guys on the challenge. If you were on the few day challenge that we did, you know, here's a lot of what we don't think about is what happens if it's the sorry. Can I write on this? I can't. Okay, can't write on it. One day we are going to figure this whiteboard out. I promise you guys. So the teeth, like the second and the first molar and the second molar, if you look at the stomach, thyroid, what this is connected to, lungs, large intestine. So when you start to see the connections between different areas of the body and these teeth meridian, it's astounding. If you know my story, I cracked a tooth and I had anterior shoulder pain, left lower lobe lung pain, and my left toe used to go numb. And Dr. Gandhi knew that over the phone just by me taking a picture of what tooth had cracked. So a lot of these biologic dentists can be covered by your health insurance. And I'm happy to put Dr. Gandhi's information in the show notes. You can reach out to his office. Oh, you did? We did that? Okay, great.
Good luck.
Dude, this is awesome.
Yeah.
That might be the greatest piece of advice for everyone on here. By the way, if you've had a root canal and you think that your symptoms are not coming from root canal. Okay. Hey, man.
Gary. Hey, Dr. Jess. Well, that was amazing because that's one of my questions that we're talking about. So 2 years ago, my cheek just blew up. I had to go get a root canal, I had an infection, I had to take antibiotics, and it went down. But my issue is my cheek is lightly still swollen. And it's like I went to the doctor's dentist, they're like, nothing's wrong with you. Go home. Like they do x-rays, but I can see it. It's like a lightly swollen part of my face that like left behind. What can I do about that?
Just what she said, you know, these biologic dentists have what's called cone beam X-ray. So it's just you rest your chin in it for it takes literally 30 seconds. And what happens is the X-ray machine goes around your head like this, and it essentially takes a three-dimensional image. And what was fascinating to me was that under my tooth, I had this little balloon, this little pocket, right? And I asked Dr. Gandhi, I said, "What's that?" And he said, "That's an area of pus infection and parasite." I said, "No way. I have no symptoms. I don't have fevers. I don't have aches and pains. I don't have any jaw pain. I don't have bad breath. I don't have funny taste in my mouth. I don't have any swelling, nothing. It's completely pain-free." And he said the reason why is because, that you had a root canal, that root is dead, that blood supply is cut off, so you don't feel that swelling and that pressure. When we take the tooth out, and I actually videoed this, I'm going to make sure that it's still up on my Instagram. If not, I'm going to link it back up on my Instagram. But he pulled the tooth, and it had this little pocket on the bottom of it, and he took, it's a little gross, so if you're squeamish, turn your camera off for a second. And he popped it, and he smeared it on a slide, and they went in the back room, and he actually showed me live. It's called Dark Field, live from his microscope, and he showed, I could see the little parasites, and I could actually see my white blood cells, my macrophages going after these different bacteria. And I kid you not, 48 hours later, those three pains went away. I had a lot of soreness in my mouth. Then I went back and had the tooth implanted, and I haven't had any issues since. And my family's had the same experience.
I'm telling
you don't
you
have to
what,
go to Dr. Gandhi. You can go to any biologic dentist.
I'm telling you what, though, if you have any weird sensations, fleeting pains, sort of numbness, a weird taste in your mouth, a weird smell, it's just a little swollen, something's off, go to a holistic dentist. Here's the reason I say that. Regular dentists can be great for certain things, but they don't have a trained eye to look at cone beam scans. They don't think anything wrong is wrong with root canals. So why would they need to look at that? They don't think anything's wrong. So it's like you have to get the right dentist with a trained eye to read the scan properly for you. And usually root canals, everyone's different. Everyone's toxin bucket and their genes are different, but usually I don't see root canals present as a problem until about 6 to 8 years after they've gotten them done, usually. And I'll tell you what, I really rock it with my patients because not a lot of people know about the dangers of root canals. And my patients come to me, I immediately know. I've gotten people pregnant who've been infertile before. I've literally stopped autoimmunity and reversed it. I've literally stopped aches and pains that were a mystery for people because of root canals. It is such a big deal, you guys. You have no idea. The H tooth represents an organ and meridian system, just like Gary showed you, in the whole body. And each tooth has a nerve that runs straight up to the cranial cavity to your brain. It's so important.
Okay, nice.
Awesome.
Thank you very much. Appreciate that, guys.
You're welcome.
Yeah, may have been the best $97 you ever spent if you get that fixed. Is it Dylan? Is he up? Oh, here we go. Dylan, that's my son's name.
Oh, does he spell it the same way?
He does. I got really in trouble with my first wife because we were checking into a flight on his first birthday, and I wrote his name as Dillon, and
Cardinal sin.
She started screaming at me, and I was like, "What are you so upset about?" It's Dyllan. So I'll never forget it.
Well, thank you guys. So this is for myself. In 2014, I had a kidney stone, went to the I didn't know what it was, but went to the ER, and then they did an X-ray. It was a kidney stone, and the doctor ended up saying, "Oh, by the way, you've got degenerative hip dysplasia in both your hips." So, what is that? And he talked a little bit, and I said, "Well, what can I do about that?" And he said, "Well, not really anything. It's just at some point you'll need to get a hip replacement, and or for both, because I have it in both hips." And I was like, "Oh, okay." Well, fast forward, I would say 2021 to 22, working out pretty heavily, lower body, heavy weights, all of that, and start having some issues with pain and discomfort in my right hip, even treadmill work, those types of things. So I go to Duke. I live here in North Carolina. I go to Duke Orthopedics to try to see what's going on. I'd looked up and saw that they do some type of surgeries for the degenerative hip dysplasia to like deepen the socket so that that ball fits in there, better, so to speak, and go there. They do x-rays. So not only do I have degenerative hip dysplasia, but then they told me I had what's called leg, calf, and Perthes disease, which they said is from when you're younger, blood flow stops flowing to the femoral head, for a period of time, it can become brittle, it can become misshapen, and then eventually blood flow kicks back in, but it can just be misshapen. So they said that surgery would not work considering I had that going on. So they prescribed me meloxicam for the short term to take for anti-inflammatory. They said when that stops working, then you can do injections every 6 months. When that stops working, time to do a hip replacement. So at the time, this was a couple years ago, I started taking the meloxicam. It helped. Um, but eventually I just, I could slowly tell with me working out that it wasn't it wasn't doing the trick, so to speak. So I actually stopped working out. I stopped taking the
Mm.
meloxicam. And in that sense, I've been fine for the last year and a half or so, but I'd say in the last 6 months or so, small things. I mean, I can't really go hiking because it'll irritate my hip. If I mow grass with a push mower, it could bother me if I go on a long drive. So it's starting to be more irritable, and I'm not really active, which is unfortunate. Wondering what my options may or may not be, or yeah, if you could point me in the right direction, that'd be great.
Oh, it sucks, Dylan. I'm sorry.
Mm.
It sucks because you were hoping to kind of carve those grooves out so that acetabulum can be back faster in the socket here and quicker in the socket, so you don't have as much pain. But now, since it's a different congenital disorder where you didn't get enough blood supply, it's like completely a moot point. So there are some things you can do to maybe help a little bit. I would definitely look into postural restoration. Have you ever heard of postural restoration?
Have not.
It's very cool. One of my best friends does it. It looks at the way the teeth hit, the feet hit, and the eyes hit to balance our bodies are asymmetric. So it looks at balancing your asymmetric body while taking care of pain for people. And so it works at breathing exercises. It works at posture exercises. It's very different than physical therapy, for example, to really work at minute movements and breath work to get your body in a better position. In
Mhm.
fact, they can actually really improve scoliosis, which is oftentimes a breathing problem for people. So,
There's a specific one called Ogoscu, which is really, really good, especially for waist down related issues. But go ahead, Dr. Jess. I didn't want
yeah, I'd love to hear more about that actually.
Yeah,
And just
Ogoscu.
non-weight bearing exercises, swimming, stretching, things like that. And then I don't know with the prognosis, of leg calf Perth's disease. But you may want to look into something like stem cell therapy or PRP. Obviously, we can't move bones necessarily without surgery, but sometimes stem cells are a type of cell that hasn't differentiated yet. They're smart cells, so they go where they're needed. So you might just want to get a consult to see if that's even an option for you.
And what was it you said after stem cells?
Oh, PRP, so platelet-rich plasma, which they take from your own blood. They spin it in the centrifuge. They get the platelets out from the top and they inject those. And sometimes the healing, cells in your own body can help take care of it.
Okay. And do you recommend, like, if the pain continues, should I push off hip replace, like if that's unavoidable, would you recommend pushing off, or when you're healthier, and younger? Like, I'm trying
I
to.
feel like, if you look pretty young and healthy now, so I think you would be at lower risk for surgery now. And, you're someone that I'm not going to pull punches with. You probably will need hip replacement. So don't sit and suffer, because honestly, you'll set inflammation pathways off just being in pain.
Right. Okay. Thank
Yeah,
you.
you're welcome.
Awesome, man. Sarb, is it? Hi, Sarb.
Hi there. Hi, Dr. Jess. Hi, Gary. My question is, I had a gene test done, and one of the things that came up was that I've got less ability to use vitamin K2. So the gene was VKORC1. I don't know if that means anything, but maybe I don't absorb vitamin K2. But that gene test was done last year, and this year I was diagnosed with osteoporosis. So I've upped my intake on vitamin D, magnesium, and vitamin K2. But I'm wondering, will that vitamin K2 actually get absorbed, and which vitamin K2 I should take with my vitamin D?
I'll let you take that, and then I'll give you my insight. I would first say that what's also important, not just K2 is important for vitamin D3 to deposit calcium into the bone. And it's also, there are some studies that I've read that have linked it to less deposition into the arterial wall. But remember that our bones are actually not calcium. Our bones are calcium combined with something called phosphorus, and they form something called hydroxyapatite. So our bones are hydroxyapatite. Calcium is a part of that, but they're hydroxyapatite. In order for calcium and phosphorus to unify, you need 12 minerals. And so very often, osteopenic and osteoporotic, men and women are mineral deficient. They believe they're calcium deficient. But I literally just did I was on a conference call with a gentleman, very rich gentleman that owned a chain of assisted care living facilities. And I asked him, I was like, do you have a lot of osteopenic, osteoporotic, folks in your assisted care living that have on calcium supplements? He's like, they're all on calcium supplements and they've been on calcium for 20 years and they all have osteoporosis. So calcium is not the answer. And very often mineral deficiencies keep bone from ossifying. Also, remember that bones respond to load, right? So just like you can't grow a muscle unless you tear it. You can't have a bone begin to strengthen unless you load it. And so there are all kinds of safe ways. Are you in the UK or are you in the US?
I'm in the UK, so I've started.
Okay.
There's a clinic here that's called OsteoStrong.
I was
I
just
think
going to
they're from
recommend that you go to
America.
OsteoStrong. Great.
Yeah, so I've started going there.
Yeah, that's great. You apply a static load to
Yeah,
your bones,
hostage.
and they will tell you that the research indicates that the strongest bones are in gymnasts, believe it or not. And the
Yeah,
reason
they
why
did say.
gymnasts have these very strong bones is just because of that one instant impact, right? So that shock sends a shock through the bone, and the bone begins to remineralize and strengthen. There are also plates. Remember, they're not. Don't use shake plates. It's not good to rattle the body. But there are plates. One brand is called a Sonic. They move only in a vertical plane, and they will put vertical concussive forces, very short bursts of force, through the skeletal system, and have been shown to increase bone density. I'd be happy to send you those studies if you'd like. Like the trampoline bouncing, has, believe it or not, as simple as that is, it's good for lymphatic flow, but it's there are also some indications for bone mineral density increase. But OsteoStrong is a great option. But Dr. Jess?
I completely agree. Teeth issues or people with cavities, bone issues is a remineralization issue. In fact, nervous system dysregulation, flight or fight, is usually because people need minerals, which create charges in the body, which create everything, and energy in the body is needed with charges. So sometimes you just need minerals for some of this stuff. The other thing is to really optimize your vitamin K intake. So lots of leafy greens, spinach, kale, broccoli, parsley, fermented foods, things like cheese, egg yolks, liver, beef liver, animal sources. These are great sources of vitamin K. Omega-3s really help balance clotting factors because you're going to have trouble with clotting, right? Curcumin is a nice natural blood thinner you may note about. Keep in mind that if you ever have to be on Coumadin, blood thinning, you will have problems processing that as well because of the vitamin K abnormality. And then finally, just getting in enough boron even and silica is really important for support calcium metabolism and vitamin D, bone repair, all that stuff.
That's why I love that Baja Gold mineral salt. Because it has all of those trace minerals in it in a natural form.
Yeah, I take that in the morning. I've got the Baja Gold salt.
Great.
Thank you.
Beautiful.
Thank you.
Doing all the things. Good job.
Awesome, Sarb. Man, who doesn't like a good English accent? Like,
beautiful.
That's so awesome. You sound so sophisticated with it. It's like very Sean Connery, Hi, Karen.
Hi, good to see you both.
Great to see you.
My question got altered. For today, I'm with my daughter in New South Wales, southern New South Wales in Australia, and all her three of her children, ranging 10, 8, and 5, have been, and her husband, have been afflicted by tick bites all over the body. I'm looking at, and a couple have been sick, like last night, was vomiting. One has headache and ear pain, and just intense itching. And I just wondered about preventative, where it might be coming from, and what we can do to help them all, because it's all through their body, all over their body, these little.
Are they having actual rashes, like actual like
Bullseyes.
redness and clearing and things on where the tick bites are?
No, it's just purely like a little pimple dot that is red and itchy.
Yeah, they're having a histamine response to it. Histamine is a kind of noxious chemical that's released from your mast cells when they see a foreign intruder or a problem. So their body is reacting to it appropriately. You know, when you pull the ticks off, you want to make sure you get all the pieces out of there. Pull them straight through without twisting. And you know, there's something you can do called a binder poultice, and it may not be too late to put that on the itchy spots. Okay, so there's an herb called andrographis. You can use that and put a little dot on the bite. They make a liquid andrographis you can get off Amazon even. It's fairly affordable.
Andrographis.
A3 of the gut.
Andrographis, absolutely.
Andrographis.
Yeah, and then if you have, we talk about binders a lot. I use a lot of binders. You may not know what that is. A binder is something that's sticky that mops up toxins and pathogens when you put it on the body or inside the body orally. So what you would do is just open up the pills of binders like zeolite clay, bentonite clay, fulvic acid or humic acid. Mix it with some filtered water till you make a paste. Okay. And then you want to just put that paste on there like you're frosting a cake. And let it dry. It will get hard, and you want to let it dry on there, and that will actually help pull and suction things from the skin, actually. And that will make
we can't even see them, the ticks.
Oh, this is not good. They're that little. Okay.
Or you want to make sure they haven't burrowed.
Hello,
into the
guys.
skin again. And that they're actually gone. So I mean, having a physician look at those with a magnifying lens, like an otoscope or something, I would definitely have that done. I mean, a lot of tick-borne illnesses come from tick bites, but they actually come from burrowing ticks as well.
And the tiny ones you don't see, the tiny ones.
Yeah. People think that Lyme disease is like, they think of like a beetle or, cockroach or something like that. They're not, these are very, very, very tiny ticks, which is very often why a lot of people don't know that they've been bitten. You're lucky in a sense that you know what the villain is. You know you've been bitten by a tick. So there are antibody tests that the physician should know how to run that can actually tell you what antibodies you're reacting to. So you can do a Lyme panel, not right out of the gate. I would give it a few days. And you can look for Lyme and other tick-borne reactions by the immune system, antibody reaction by the immune system. The good news is to get a hold of it at this stage is phenomenal. Very often people get bitten by a tick, they have this little bullseye rash, these symptoms go away, and then they come back some period of time later and they don't relate it back to the tick bite, and then these go undiagnosed for months, sometimes years, and you usually have some abnormalities on like the CBC, the complete blood count, but a lot of times doctors don't pick up on these, and so people end up with something like chronic Lyme, and then it starts to express itself as something completely different than a normal viral infection.
It's very important. This can be a war if it gets out of control. So you really want to make sure, have them wear white clothing when they go out so they can see the ticks on them. This is preventative. You definitely want to go and get tested from a functional doctor just to rule this out. Vibrant Lab has a great Tick-Borne 1.0 or Tick-Borne 2.0 test that's wonderful. I use them every day. And I would recommend functional testing because
Vibrant is actually available in Australia too.
Yes.
So what's the test?
Vibrant.
Finding our immune.
It ironically was the one that I was just showing you up here on the board. Vibrant, like to be vibrant. Yeah.
Yeah. And so you want to look at that.
Oh, we just linked it into the chat for you.
Yes, there it is. I see it. It's really important though, because you don't want to miss this, especially if they start having like slight fevers, nausea, queasiness, stuff like that. This is an acute Lyme attack. So it's really important to go get tested and get treatment. And I actually don't treat chronic Lyme disease with antibiotics, but if I catch an acute Lyme case and it comes up acute and they're having symptoms, absolutely doxycycline. Absolutely. Okay. It's appropriate in acute Lyme.
So prevention is the white clothes. Anything else? Or can you smear anything on your body to
Yeah,
stop
there
them?
are some essential oils and things that will help keep stuff away for sure. There are some natural remedies that aren't as poisonous as things like DEET or something. But honestly, ticks are very poisonous too. So it's a fine balance, right? If they're all over people, we have to help them keep away or keep their bodies safe in some way.
And
Yeah.
do chooks have anything to do with it? Because they've recently got some chooks.
Some
They're chooks are chickens that lay
Oh,
eggs.
oh yes. That's why. Now, chickens sometimes I think will eat the ticks actually.
Oh, good. That's
Yeah,
good.
yes.
All right, so I just need to get some vibrant test of all of those, 3 of them. And then if it shows up, to get treated with doxycycline.
Yeah, and then you're going to need longer than 2 weeks. That's the standard treatment, but most people need they need like a month. Okay.
Before you test.
Yeah, and it wouldn't be a bad idea to see a holistic doc and get some herbs too to go with that because that can be synergistic. But be sure and ask your doctor. It's really important that they see someone.
Because it's only just a couple of weeks, maybe a week, just over a week that these
You want
things
to catch this early. Trust me, you can save yourself so much heartache.
Mm-hmm. I totally agree.
Okay. Thank you so
Awesome.
much for that. All my questions went poof when I saw this.
That's probably normal.
Okay.
Okay.
All right, we're going to take 2 or 3 more questions with Dr. Jess before she has to hop off. And she is so incredible. Wow, thank you so much. Like, what a treat having you on here for my VIP community. I hope you guys can all like send like a clappy hand or a thank you. I mean, I know she can't hear you guys, but it's just amazing to have incredible functional practitioners like this, give us their time and their expertise. So we're deeply appreciative of this.
Thank you so much.
Kendall, what's up?
Hi, Kendall.
Hey, hello. Can you guys hear me?
Yeah.
Oh, loud and clear.
Cool. I wasn't sure I was going to work with the headphones. How are you doing, Gary?
I'm doing amazing, Kendall.
I am a little bit starstruck, so give me a moment to catch myself. I appreciate everything that you do, man, and I'm happy to be here. Okay.
That is so kind of you. Thank you.
Seriously life-changing. So what I got a question for is, what I've noticed, I'm going to be a tad bit graphic. So I've been fasting. I'm on a 40-day fast for Lent. Plus, I've been fasting just for personal reasons. I've been extremely overweight lately, so I've really pushed myself to just get back to a more disciplined me. And I thought a 40-day fast would be the perfect thing for that. I'm on day 23, and I'm talking all the way no food of any kind. The most I'll do is maybe a cup of chicken stock or beef stock if I'm really, really, really low. But other than that, it's just strictly water and some juices. So the problem I had before and the problem that I've noticed is that almost 3 weeks in, I'm still using the bathroom, if you understand what I'm saying. That to me is scary. So I'm thinking my metabolism might be off. I don't know, but there's no reason I should still be using the toilet 3 weeks after not eating anything.
Well, when you say juices, what kind of juices are you talking about?
Just like tangerine juice, or I'm talking 100% bottled juice, something like this, from Trader Joe's. It's 100% juice, organic beet juice, organic strawberry puree, organic apple juice, or, just juice, nothing, just a little bit of cows. Cause I do construction work. So I have to consume some forms of calories, but I'm extremely deficient, like extremely. So
when you say deficient in what?
In calories, like the caloric deficiency is, I don't even come nowhere near maybe 600 at the most. And that's me
Yeah.
So
I
my
might
bad.
recommend that you do that you switch up the juices for things like bone broths because juices are very high glycemic. They're going to give you a
Okay.
sugar spike and you're going to come back down. The majority of the time when people do water fasting, they don't recommend that you take high glycemic things because your body is trying to go into and stay in a state of ketosis, right? So it actually goes
Okay.
from being a sugar burner into being a fat burner. Your body
Okay.
runs on something called beta hydroxybutyrate, which is a ketone body, which it can run on very efficiently. You don't look
Okay.
heavy, but I don't know how heavy you are. You don't look heavy on
That's
the
because
video.
I've lost 30 pounds already. I
Oh,
look
Okay.
way
congratulations.
worse than this. Way worse than this.
Yeah. You seem like your energy is good. Kettle and Fire
Yeah.
bone broth is probably my favorite. You can get it just about anywhere, but I would actually try to stay away from the high glycemic juices. To be honest
And
with you, but go ahead.
okay. Okay, I could cut the juices. I have no attachment to anything. I came here. Well, my true question was, um, what type of diet should I get on to go further into losing more weight and to keep my muscle, keep my how do I word this? Stay strong. You know,
Well, look, if
I'm
you're going to
decently
finish the
strong.
17-day fast, I mean, that's the first. If you're going to do what you said you were going to do in the beginning, which is 40 days, you're 23 in, you have
Yeah,
17 days
yeah,
left.
yeah,
I
yeah,
would
yeah.
highly suggest that you add bone broth, which you can still stay in a state of ketosis and you can actually take in fluids. I would also make sure that you're taking mineral salt at a minimum, like a
Yeah,
Baja
no,
Gold
I
sea salt.
definitely. Oh yeah,
Okay,
100%.
great.
That was one of the
And
first
Dr.
things
Jess,
you said I started to do immediately.
beautiful. And then Dr. Jess,
I
where do you
think
fall?
Yeah,
Yeah.
about the bowel movements, I just wanted to tell you, you wouldn't even believe how much residual waste the intestines can hold on to.
They're 30 feet long. Yeah.
It's wild. And also, you can be sloughing the intestinal lining, almost like a mucoid plaque could be coming out too. And even though you're not eating anything, the microbial activity, the gut bacteria continues to function down there, and they do produce waste products too that can contribute to bowel movements. So I'm not so alarmed by it at all. I would tell you too that most of the people I see in clinic are mystery patients, right? They come to me, they already have their diet so reeled in, they're eating like 10 things, if that. I don't have to
Okay.
touch their diet at all. And the diet is not why they're losing weight, not losing weight sometimes. Sometimes it's because they're stressed out. Sometimes they've got a pathogen. Sometimes they got heavy metals. So just keep in mind that the inflammation can come from other things besides calories in, calories out too.
Okay.
Yeah.
You said pathogens, heavy.
And the last thing I'll tell you is Perfect Aminos does not break a fast. Someone asked if
I definitely have. I didn't bring my bottle, but I stay with it. I keep it on deck for sure, Gary. Trust me.
I believe
I,
you.
yeah, no, you trust me. I follow
People
the
are giving you
majority of
props,
what you
man.
say.
They're like, props to Kendall. Okay. So yeah, I know Dr. Justice is short on time. We got about 7 minutes left. So let's see if we can hammer one or two more questions. Kendall, I'm really proud of you, brother. Keep up the good fight. We'll have to
Thank
get
you
you
so
back on
much.
the next the next VIP call and see how you're doing. I think it's Maureen. Hi, Maureen.
Hi, it's Marlene. You got it.
Marlene, sorry,
You're
words
great.
are so
You're
small
great.
down there.
You guys are great. So,
Oh, thank
Gary,
you.
my thyroid, my doctor has put me on a thyroid prescription, and I am absolutely adamant that I'm not going to continue to do that forever. So I've already started with I started with the Thorn B Complex 12, and I've been taking 2 of those every morning. And then I'm doing the Thorn Selenium, taking 1 of those. And I'm also taking some iron every day, 12.5 milligrams of something called Optimax Iodoral. I don't know what else I can do, but we just ended up testing my blood again, and the thyroid's not really doing anything better. Even, I'm taking the thyroid prescription, but I was hoping that it would be even better than what it's showing. And then I would be like, okay, I'm done with this prescription.
Well, what are you taking? Levothyroxine, Synthroid, Armour Thyroid,
Actually, this says just thyroid NP.
Okay.
And 60 milligram tablets.
Yeah, that's a natural dissected thyroid. But go ahead, Dr. Jess.
There's so many things to look at here. So when I treat people, I like to treat mind, body, and spirit. So I like to trace back to see if there were any stressors that happened when someone was diagnosed with a thyroid condition or when their energy started to fall off. Sometimes there's a connection there. I also like to test for water damage in the house, which can cause thyroid problems, heavy metals. If you haven't done that, mineral deficiencies can do this. So sometimes if people have a lot of digestive issues and they're bloated a lot, I'll switch them over to liquids or powders or liposomal just to ensure they're absorbing. That's not everyone, but a lot of people. I would also make sure that you don't have signs of parasites, SIBO, pathogens that can cause a disruption in the thyroid, because out of all the endocrine organs, it's really the most sensitive. And things like mercury, heavy metal, can replace iodine.
Huge.
Yeah, so can fluoride in the water. So I make sure people have really good water filters and shower filters. There's just a couple things to check. Root canals again.
Okay. I had my gallbladder taken out in 2015. But I've also got all the water systems in my house that Gary recommended from Echo.
Perfect.
So yeah, I've got that through the whole house and for my water at my sink for the
This is
kitchen.
actually a good teaching point for you. You said something. You said I had my gallbladder taken out.
Yeah.
When was that?
2015.
Yeah. Okay. So if the endocrine system is like a stool with 4 legs, one leg is the thyroid, one leg is the liver and gallbladder, one leg is the sex hormones, and one leg is the adrenals. So if any of the legs are wobbly, the whole stool is going to be off kilter with its metabolism in the different organs. So I would really work on opening drainage with you, opening up your bile, making sure it's flowing properly. I know it's not because you had your gallbladder taken out. That doesn't fix the problem. The liver stagnation is still there. I'm making sure you're pooping 2 to 3 times per day. You can sweat in the sauna within 10 to 15 minutes. Your liver.
I have a dry sauna and it takes me 30 to 35 minutes to start to even sweat.
Oh my gosh,
that's what's wrong.
And I walk into it when it's like 130, 140 degrees.
That's what's wrong. So your drainage is a little blocked. So toxins are coming in that affect your body and you can't release them very well. If you're not having regular bowel movements, you can't sweat well. So I'd really work with you on opening drainage so that you can release the things that might be causing you to be sick.
Okay. And how do I do that?
It's not a simple question I can answer right here in the scope of things, but kind of the things I just described are ways that you can look at opening drainage. There are certain supplements and biohacks you can use. Sometimes I use enemas if people are really constipated. I have people get in the sauna 3 or 4 times a week if they have access to one. I have certain supplements like TUDCA or B vitamins or things like that to open up the bile and the liver.
Okay.
Yeah.
Very good. Thank you.
You're very welcome. Yeah.
That's also, I would also recommend digestive enzymes. For anybody that's had the gallbladder removed, digestive enzymes can be a game changer because very often they have trouble emulsifying fat. Dr. Jess, thank you so much for joining us. We have all of your information linked in the chat. You're an absolute angel. I'm super excited for our podcast to come out. My VIP community has gotten to interact with you before. We'll take one more question. Oh no, let's put her back up there.
Oh yeah, what happened?
Don't. Is it Kaiway?
Actually, Katie is my son, and he practically threatened me to get on here.
All right, I'm not reading names on the teleprompter anymore because I'm like over 4 today. I'm just gonna say, hey, you. Welcome. I was just thanking Dr. Jess, but we'll see if we can squeeze in one more question. And I'm really going to prepare next time for this to make sure that we go through some of these testings that I promised for our next live chat. But go ahead.
Thank you. The reason I'm on here is because my husband was actually he had atrial fibrillation prior, and he had an aortic dissection last year. And just on March 9th, he had an ischemic stroke and intracranial aneurysm diagnosed. And the guy that was talking about fasting, he was 400 pounds before we did fasting, and he got down to 220. So, which was, we were trying to get him healthy again. But we've had all of this happen. So he does take medication like Xarelto, Metoprolol, pantoprazole, furosemide, Senna, and they gave him this time atorvastatin. I don't know if you know.
For cholesterol.
Yes.
So that was the added medication. So my son wanted me to get on here and ask you folks, what could we do for him?
There are a couple of things that I would consider. First of all, I'm not qualified to tell them to get off of any medication, but I would look into a supplement called Endocalyx. It's actually you take 4 of these capsules twice a day, and it helps to repair the glycocalyx, the lining of the arteries, because with all of those repeated types of arterial compromised situations, you really want to think about, how do I repair the vascular system? It's gone through a lot of stress. Even that volume of weight loss can be very stressful, because trapped in the fat cells are lots of toxins. Very often when people experience dramatic or rapid weight loss, they can actually get very sick from it, because these toxins go back into the bloodstream. So Endocalyx is a relatively inexpensive product. I've seen pre and post images of the vasculature in the floor of the mouth, dramatic changes to vascular integrity. I would also talk to your doctor about checking something called homocysteine, and looking into whether or not he has something called hyperhomocystinemia. Lots of links between very elevated homocysteine and precisely the types of conditions you're saying that he struggled with.
And then also, I'd like to add something too. You said atrial fibrillation, and then he ended up having a stroke. Was it because of the AFib, where he threw a clot from the atrium or the ventricle?
Well, he had the aortic dissection last year, so that ruptured the aorta. So that added, to his complications. So
Yeah, absolutely it did. And aortic dissection isn't something that's a risk factor from AFib at all, usually. So atrial fibrillation is irregular heartbeat. It's irregular, guys. So what causes an irregular heartbeat? Sometimes mercury fillings, because mercury is a conductor of electricity. Okay. Does he have mercury amalgams?
and yes, and he was starting to lose some of his teeth too. So
Teeth are the problem. Do you know how connected they are to cardiovascular issues? It's unreal.
Yeah.
It's unreal. So I can promise you the teeth are one of the biggest issues here.
okay.
I fixed my dad's atrial fibrillation by having them safely remove his mercury fillings.
Okay.
Wow. That is amazing.
Yeah.
Okay.
Sorry.
So I have Jess, I want to thank you again. I know you got to go at 7 o'clock. So
No, it's okay. I had so much fun.
Okay, if you want to stay, let's stay. I mean, I have a little under 30 minutes left, so I want to try to get to as many.
I actually have dinner plans, so I can't, but I want to
Okay.
say that I did have so much fun. If you guys ever want me back, I love your community. They're wonderful and they ask very thoughtful questions.
That's amazing. Well, thank you so much. I mean, you're an absolute blessing. We have very like-minded ways that we approach these things. So thank you so much for joining today, my community. Guys, make sure that you check out the podcast that Dr. Jess and I did, and hopefully you will come back again and be a guest on our VIP community. Thank you so much.
Anytime you ask, Gary.
All right. Well, don't threaten me with a good time, because I will invite you every month.
I'll be here. I'll be here. Just let
All
me know.
right. That'd be great. Who'd like to see Dr. Jess again?
Thank you, Gary, so much.
People are thanking you, saying thank you so much. You're a blessing. God bless you. You're priceless. I don't know if you can see the chat, but you're getting
you guys
you're
are
getting
so
lots of love in there, Dr. Jess.
Thank
Really,
you,
really.
everyone.
Yeah, just
I'll be
amazing.
back. I'll be back.
This is a great community. Have a great dinner tonight.
Thanks. You guys have a great time partying with Gary. I'll see you soon.
If this is what you call a Friday night party, okay, we got a little under 30 minutes left, so let's try to fire up some questions, guys. Hi there. I'm going to say Layla, but you're going to tell me it's something else.
No,
you're muted.
it's Layla. Do you hear me?
All right, great. I got it.
Awesome. Hey, I was watching Mel Gibson on Joe Rogan's podcast, and he talked about how he was on like in a fight or flight state forever. He couldn't sleep. He did the Dr. Amen thing, and he said that the doctor prescribed for him vitamin B complex and fish oil, and also hyperbaric chamber. And then I saw you on PBD podcast, and what you described was to a T my husband, which was the same thing Mel Gibson said: fight or flight response, no sleep. Like he sleeps maximum like 4 hours a night. It's devastating. I would describe him as a tormented soul. He is in such bad condition, and we could not do anything. Like he even takes like trazodone, like other sleeping. The only thing that works for him, like as a sleeping medication, is like clonazepam or Xanax, like stuff like that. And we don't want him to
heavy
go on
tranquilitics.
this stuff.
Yeah. So, you know, one of the things that I have seen work over time is, you know, we and it's a commitment, but it's attempting to get back on a natural circadian rhythm. And so the way that we do that, and it's torture for people at first because they have a hard time quieting their mind. One of the reasons why minds don't quiet is an elevated level of catecholamines. These are the fight or flight neurotransmitters that are also part of the cascade of anxiety and the sensations of fear, right? So at low levels, they're in everybody's system right now, everybody listening to this. As they rise, you'll have these, you'll be in an awakened state. And by awakened, I mean like your brain is awake. As they continue to rise, you feel a little bit of anxiousness. As they continue to rise, you start to experience symptoms of anxiety. And if they continue to rise, you can actually have, you know, rapid heart rate. You could be sweating. It can affect your respiratory rate. It can dilate your pupils. And as it continues to rise, you could even have a full-blown panic attack or even paranoias. So these aren't multiple different things. This is a rise in the same thing. And so you're right, and so is Mel Gibson. Mel Gibson, I think, also on that episode gave me a shout out. If you were listening, he said I was on that Brecca thing. Yeah. So let's start with the basics. Methylated multivitamin, methylfolate, S-adenosylmethionine, SAMe, sometimes in the morning can be very good. Trimethylglycine, in the form of B12 called methylcobalamin, just the methylated nutrients to try to get him methylating again. I would really recommend that you test for the big four: mold, mycotoxin, metals, viruses, parasites. The Vibrant test is an excellent test as a place to start. The other thing that I would do is I would be hyper vigilant about trying to get him on a good circadian rhythm. So there are four kinds of outside tools that you can use, and I'll give them to you in varying levels of increasing cost. There is a device you can wear around your neck. It's not a device that I'm affiliated with. I've used them before. Cristiano Ronaldo gave me one. I actually found it to be very effective in a client of mine who was suffering from anxiety. It's called a Pulsetto. It actually has electrodes that override the vagus nerve. And it has an app that works on your phone. It's not a very expensive device. Hyperbarics are excellent for this. I can put you in touch with Dr. Jason Saunders, or you can actually look up Dr. Jason Saunders' book. He wrote the book Hyperbaric Medicine. But very often, hyperbarics have a way of calming down the neuroinflammatory complex that is keeping people's circadian rhythm from returning back to normal. There is also it looks like a lawn chair, and it's called a shift wave. Shift, like shift work. And shift wave is a combination of vibratory massage, acoustics, and sound that you wear on your head. And essentially what you're trying to do is shift your husband's state from being sympathetic, fight or flight, to parasympathetic, which is rest and digest. And I think very often people think that if you're stuck in the sympathetic state, the fight or flight state, that you're agitated and you're hyper aware, or your heart rate is fast, or you're just angry, and that's not actually true. You can be anxious and be experiencing mild anxiety and not be having a full-blown panic attack, be perfectly functional, but also unable to sleep. And what happens is when these people lay down to go to sleep at night, they get hyper focused on how they feel. If their heart rate is a little bit rapid, they cue in on that. Their minds have a tendency to wake up and even race at night. They'll have a tendency to think about worst case scenario type thoughts, especially at night. And then they get on heavy tranquilitics, which I would say, Xanax, zolpidem nitrate, diazepam, Lunesta, Klonopin. And I wouldn't say to drop any of those just yet, but the idea is to calm the nervous system down. So things in the room like red lights, limiting blue lights, setting a specific bed and waking time, because these people's circadian cycle is off, and sometimes they try to put themselves to bed at 11 o'clock at night. Sometimes they put themselves to bed at 4 o'clock in the morning. And it's just, they're all over the place with their circadian rhythm. It will take a few weeks for this to come into play, but actually setting an alarm 15 to 30 minutes beforehand, and doing things like a contrast shower, breath work, the same routine over and over and over again. No screen time, red light in the bedroom, using an eye mask at night, learning to do breath work while you're in the bed. And then every day, regardless of when you fall asleep, waking at the exact same time, preferably within the first hour to 90 minutes after sunrise. And then actually going out and getting natural light at the same time every single morning into your eyes. The only reason why we're trying to do this is to try to reset the circadian cycle. Disrupted circadian rhythm and sleep disruption is a form of torture.
Yeah.
And I have a very close friend who happens to be a professional DJ. In fact, my daughter and my wife are at his show right now. He happens to be a professional DJ, and his circadian rhythm was so disrupted, as you can imagine, when you're a DJ and you're playing at 2 in the morning, then 5 in the morning, then 1 in the morning, and you're in multiple time zones and you're multiple places around the world, your circadian cycle just gets wrecked. And what happens is eventually the stress to the nervous system sticks you into a fight or flight response, and you're stuck in the sympathetic state. And then you start taking drugs to try to go to sleep. Those keep you in bed longer, or at times when you actually shouldn't be sleeping, and the whole cycle gets out of whack. So that's what I would do. I would really try to be militant about giving the body as much consistency as possible. Eating at the same times, going to bed at the same times, using red light at night, contrast showers, getting into bed at the same exact time, using an eye mask, keeping the room cool, doing breath work at night, taking the methylated multinutrients that we talked about before, and then trying to wake up at the same time every day. Super critical, whether you're exhausted and went to bed at 1 a.m. or you're well slept because you went to bed at 11 p.m., up at the same time every day, getting natural light in the eyes. This has a way of resetting the neurochemistry in the brain, so you get on some kind of cycle, because the body doesn't have anything that it can rely on. It doesn't have, we're creatures of habit. We have a circadian rhythm. We have a biological clock, and when this gets disrupted, sometimes it's very hard to put it back on track. And so we don't want to do it by anything other than being really intentional. Okay.
Well, so he has been doing the contrast shower, and he has been doing the breathing. And about with the circadian rhythm, we go to bed early. We go to bed around 9:30, and he has no problem sleeping. But he wakes up around 1 or 2 a.m. and he cannot go back to sleep. And what he describes is that the wheels never stop turning, like in his brain, and he cannot go back to sleep. So that's how he gets his sleep, like from whenever he falls asleep, which is early at night, and then until like around 1 or 2. And he has to work at 6, so he wakes up at 5, winter or summer. So he's up right, at the dawn. But that 4 hours in between, he can't go back to sleep. And I've heard you said that these people need a higher dose of B complex and other stuff. Yes. We have bought like the same. We have bought like NAC. We bought that folate that not the folate, but the other one that you said to replace the folic acid. We got that one. So what dosage?
The other thing that I would really try is I would try sleep and magnesium breakthrough by BiOptimizers.
We got that one.
Okay, So I would try the powdered form of Sleep and Magnesium Breakthrough by BioOptimizers. And if he's taking it at night and still waking up at the same time, I would take the Magnesium Breakthrough when he wakes up, not when he goes to sleep. Take the Sleep Breakthrough first. Then when he wakes up at night, take the Magnesium Breakthrough, because the worst case scenario, this will not make him sleepy the next day. It will just help quiet the squirrels.
Thank you so much.
You're so welcome. Hi there. You're muted. You're still muted.
Hi.
There we go.
Am I unmuted?
Yes, you're unmuted now.
Hi, I'm Stacy.
Hi,
How are
Stacy.
you?
It says Marty, so I'm glad I didn't say Marty.
That's my husband's name. That's okay.
Okay.
The accountant, his name. The question I had relates to, I've lost 9 teeth since 2019. And I have a biological dentist. It took me 3 tries to get somebody that the ozone, the PRP, or all of those kinds of things. But we weren't able to save my last tooth. And now I'm trying to figure out, where do I go from here? You know, I think I have a good resource in my biological dentist.
That's great.
He's doing a lot of the things that you've talked about. We're kind of discovering in the 3D cone beam that my right maxillary sinus, I think, was the source of the top tooth that I lost. Recently, I had surgery in March of last year to save the tooth, and then I lost the tooth in December. That I've had ozone. So my thought process is this gut related, and should I be looking in that area? And if so, what would be the best test for me to start with? Because I'm kind of at my wit's end. I'm doing everything right. You know what I mean? I'm going every 3 months to have my teeth looked at. I have fastidious oral habits.
That's great.
You know, so I'm just trying to figure out where to go from here.
So first of all, congratulations for having a good biologic dentist. That's amazing. Secondly, we talked earlier about, you know, teeth and bones are very similar. They are hydroxyapatite, and what we need to form hydroxyapatite, calcium and phosphorus, which you're likely not deficient in. We also need minerals. So I would be making sure that you're taking a mineral supplement like a Baja Gold Salt. It's very
doing that. Yep.
The other thing that I would be really militant about next would be healing, sealing, and repairing the gut if you have gut-related issues. So how do we do that?
I've had those for 25 years. So that's part of this whole piece of it. Do I go like a gut test? Like, do I go through and do a GI mapping first? Do I do blood work first? Like, I'm trying to figure out what's the next step for me, you know?
So I would definitely do a GI map test with your functional medicine doctor, which will actually give you a gut microbiome, and it will also look for proteins that actually are in your blood when you have leaky gut. These are confirmatory proteins that are not present in the gut if you do not have leaky gut, and they are if you do have leaky gut, because that pro-inflammatory response can have all kinds of downstream consequences. So yes, a gut a GI map, which will actually not only map the gut bacteria, but it will also look for this protein. That's confirmatory. And then afterwards, if you have a good functional medicine doctor, there's 4 things you want to talk to them about. Binders, what type of gut binder to use, which is either an activated charcoal, a zeolite clay. One that I've found to be incredibly effective is one called ToxyPrevent.
And I saw that. I'm sorry to interrupt you. I saw that in one of your prior Q&As in November or December. That's the next step for me. My dentist put me on the zeolite, and my guts have been torn up, and I have an output.
Some people don't do well with zeolite Clay. They'll do Toxi Prevent. Starts at a single capsule, and you work up to 3 capsules. So,
Okay.
I'm currently unaware of anybody that's had a reaction at a single capsule. It may have happened. I'm unaware of it. I've seen the most miracles with that supplement, and it's readily available. You can just order it online.
Yep.
They just put it in there. Make sure it's the lower GI formula. They have an upper GI for like acid reflux, and it's the lower GI formula that I'm a huge fan of. But the GI map will be very specific. The gut microbiota, allergens, and then also this protein that will tell you have or you don't have leaky gut. That's exactly it. Then the other thing that I would consider is talking to your doctor about peptides, specifically one called BPC-157. This is actually a gastric pentadeca peptide. It is synthesized from gastric juice. It's tolerated extraordinarily well orally. It's great for healing and sealing and repairing the gut. It also has significant anti-inflammatory effects. It's not expensive. You can get nutritional grade BPC-157. You can order that online. And there it is right there. By the way, neither of these products are my products, and I have zero affiliation with any of these companies. I just happen to know people that have had miracles worked in their lives by taking these. So that's definitely where I would start.
Well, can I ask you, so would you start with the GI mapping before you try to do some of these other things? That sort of has been my
question. I would start. Yes, I would start with the GI map. It takes the guesswork away, and then it also,
that was kind of where I was headed with it, but I'm really enjoying being a part of this, and it's getting me back to my roots of breathing and bone broth and all of the things that I'm already very familiar with. So thank you for your time.
Yeah, this is a great community. So thank you for being in it. Okay, Marty. One more question. I want to get if you have additional questions, you can DM Morgan and get them on so I can get a chance to answer those. I'm actually really excited that Dr. Jess came on. I'm going to try to bring her on more often. She's amazing. I thought we had released her podcast, but my team tells me it's coming out soon. The 22nd. Okay. Okay, fire it up.
Am I up?
And you're muted. Oh, nope, you're off. Okay.
It's I always tease my mom. I say she didn't have phonics when I was born, but anyway, first of all, I want to give a huge shout out. Last time you talked to me, you told me to get a mat to put in my sauna for my feet, for my cracked heels that I was having.
Yes, I remember that.
I'm going to go get a pedicure and get those filed down. And they have, and I am able to get onto, what I'm doing is getting on my treadmill for 10 minutes right after I eat. And
unbelievable. Awesome.
It's the first time in 20 years that I have literally been able to walk. So thank you, because
oh my God.
And so I wanted to say thank you so much for that. And then the other thing that I wanted to say is I too have been somebody who's been struggling trying to sweat in the sauna. I also don't have a gallbladder. I started doing a 30-day cleanse 3 days ago, so I've really upped the amount of water that I'm drinking to do the supplements I'm using. And all of a sudden, I'm just pouring sweat within 20 minutes. So I don't know if that means that like I'm opening things up. I mean, I don't.
Yes.
So
you're restoring what's called vasomotor circulation, which is the ability for your, surface capillaries to reach, the surface of the skin, and you're going to begin to eliminate waste. I mean, isn't it amazing? This is the first time that you've been able to walk like that in such a long period of time, and yet we didn't use any chemicals, any synthetics, or any pharmaceuticals. I'm so happy for you.
3 days, I'm down 9 pounds, so that's like huge for me. So. Thank you.
I want to say I stay in the VIP community because I want to keep checking in on you on this journey.
Yeah, I'm really excited. But I have been hearing you talk about binders, and I've heard so many people kind of say if you get in a sauna, you should use a binder. And so I've been really confused on what kind of binder do I use or
yes. So a binder is something like an activated charcoal. silica clay, zeolite, which is, you know, more of an aggressive one that a lot of people don't well tolerate, or something like Toxi Prevent. Charcoal binders are relatively innocuous. You know, you can take them in different strengths. I would get a charcoal binder that you take right before you get into the sauna, so that as your body starts to detoxify and eliminate waste, it helps bind and carry those out through the stool. And generally harmless. Make sure if you are sweating, put the Baja Gold Salt in your mineral water, because, you know, when you sweat, you don't just lose water, you lose sodium, potassium, magnesium, and toxins. The other thing that's important is, while you are still sweaty on your skin, when you get out, unless you get straight into the shower, take a towel and wipe the sweat off of your body. It's good to do that while you're in the sauna as well, because one of the things that comes out of your skin, believe it or not, is heavy metals. And they will resorb right back into the skin if you get out of the sauna and just dry off. So if you get out of the sauna and go straight into a shower, great. But if you don't, just bring a hand towel in there with you. The fact that you're starting to sweat after 20 minutes is amazing for you.
Last time you told me that I was somebody that probably shouldn't get like right into a cold shower after the sauna, but I'm wondering now that I'm sweating if maybe it would be okay to go ahead and try that.
Yeah, and I would get into a cool shower, right? I wouldn't go from the high sauna and just straight into ice cold, but I would make sure to just take a hand towel in with you, wipe your body everywhere that there's sweat, you know, put it behind your back, and just try to dry yourself as you're sweating. You'd be shocked at, if you were to wring that towel out and send it for testing, what's in that towel. It's amazing. It's probably one of the best natural detoxification methods that we have. You may want to start to consider a liposomal glutathione and a charcoal binder, just one capsule right when you're getting into the sauna, just so that as those detoxification pathways activate, you have a little bit of charcoal binder in your stool that helps carry additional toxins out of your body. The fact that you are starting to lose weight, beginning to sweat, and can now walk on the treadmill without pain in your feet, based on what we spoke about last time, that is a huge step for you. I can see your future, and it's very bright, and I'm really excited for you.
Thank you. I'm really excited too.
Yeah,
me too. My life. I mean, literally in 20 years, I have been so frustrated and just trying to figure out how do I get better. And I appreciate you so much. So thank you.
That's really kind of you. Guys, I love ending on a story like that. You know, we are not as sick or diseased or as pathological as we think we are, guys. Very often we're just nutrient deficient. Lifestyle medicine is changing our lifestyle and our dietary habits, what we call modifiable risk factors, the things that we have control over that can dramatically change the trajectory of our life. I mean, I think we're going to accept this gentleman's wife as one of our VIPs to make a new Ultimate Human project. I'm going to get a physician to oversee his wife's care, probably Dr. Jess. I'm going to get her to sign the requisite releases so I can share the information with you. And let's see if we can take somebody who really hasn't felt normal in 15 or 20 years and give them their life back right in front of you guys. I'm going to do a lot more homework to be ready to teach next time on the testing, and show you some of the pathogens that show up in the blood and how you can get them out. But remember, being a part of this VIP group means you get exclusive access to early content. You get private calls like this. You get the incredible community of people dedicated to optimizing their health. Some of my OG VIPs are in there every day answering questions. If you haven't already, make sure you download the app so you can stay plugged in with all the latest insights. It's free. Updates, giveaways, and discussions. I'm going to do more giveaways into this group. I'm going to take more clients, from this group, sign them to a licensed practitioner and go on this journey with them. Also, somebody asked a question about picking a winner for our signed cold plunges. We do need to do that. So I'll make sure that we do that, and we'll make the announcement. Oh, well, we're going to do it in the next call.